Hello, 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 everyone. Yes, welcome back. I'm Dr. Tamara Beckford with Your Caring Docs, where we're going to provide you with some great info so you know what's going on in your body, make some great decisions, right? So that you can stay healthy, wealthy, and of course, you'll be wise doing all of that. So today, we are going to go over part two of blood pressure medications, right? Medications, some side effects. We went over a couple different types of blood pressure medications a couple weeks ago. You can check it out. But today we're going to go over the second part. Alrighty. So we are going to start by sharing that screen. So let's get that high blood pressure under control. Medications and their side effects, part two. All right. So before we go any further, I love that you guys are always here every Friday checking me out. But I do want you to know that we are also on the Tube. That's right, YouTube. That is where we are homed. We are YouTube/Your Caring Docs. That's URCARINGDOCS. Your Caring Docs over at YouTube. Subscribe, hit that bell so you'll be the first to know when we have some new info popping up. All right. So let's talk about Leroy. We're going to do Leroy's story today, right? So Leroy is a 78-year-old male. He has high blood pressure and he's noticed, and his docs noticed, that it's been worsening a little bit over these last couple of months. Now, Leroy takes his blood pressure medication religiously, right? But on his last visit, his doc says, you know what, Leroy, I know you've been taking your medications religiously. Despite all of that, right, your blood pressure has been creeping up and now it's kind of a little bit out of control. We need to add an additional blood pressure medication. So the doctor adds nifedipine, which is a common blood pressure medication. And Leroy, he starts taking his medication, but he starts to notice that he's having a headache. And he's like, okay, am I having this headache because my blood pressure is out of control? So he checks his blood pressure. His blood pressure is normal. So what is going on with Leroy? So Leroy is on a medication that's called a calcium channel blocker. So how does a calcium channel blocker work? So this particular category of medication, it blocks the calcium from going into the cells of the heart, the smooth muscle cells of the heart, and the blood vessels, right? So when calcium goes in, it causes a nice forceful contraction, like nice and strong, right? So if the blood pressure is already elevated and we're doing like super strong contraction, then boom, the pressure is going to go even higher, right? So if we relax that, and which you relax it by not allowing as many calcium to go in, so the contraction is not as strong, we are able to bring the blood pressure medication or the blood pressure down via this medication. There are some side effects, and there's some other medications that's in this category. Some of you guys might know amlodipine, right? Amlodipine is another one. Diltiazem, cardizem is another name for diltiazem. So those are medications that are in the calcium channel blocking category. They do have some side effects, right? Headache. Headache is one of the side effects, and some people might also notice that they'll have some swelling in the lower extremities, especially if you're on amlodipine, right? You're like, I'm taking this amlodipine, all of a sudden I'm getting this swelling in my legs. Yes, that is one of the side effects of this medication. Constipation also is another side effect. So that is Leroy's story. So Leroy's Your Caring Doc switched his medication to another category, and Leroy's headache went away and blood pressure is boom, under control. Good job. Go, Leroy, for letting your doc know what's going on, right? And just not stopping the medicine and having the blood pressure be out of control. Leroy took the initiative to just inform his doctor. All right, next we got Cheryl. All right, Cheryl. So Cheryl is pregnant. She's 30 years old. She has a history of high blood pressure, and she's been taking lisinopril for her blood pressure. She found out she's pregnant, and she is excited, right? She's like, oh my God, this is great. This is my first pregnancy, and super excited. Then she starts thinking, oh my gosh, I have high blood pressure, and I'm pregnant, and I'm on lisinopril. Can I continue taking this medication? Is this medicine safe for me, for the baby? Oh my God, what's going on? So Cheryl contacts her Your Caring Docs OBGYN, and then she is told, like, hey, Cheryl, don't worry. We are very excited that you're pregnant also. But we can switch you to another medication that has less issues with the mother and the fetus, right? So this medicine is called methyl dopa. So methyl dopa it's in the category of an alpha 2 receptor agonist. So this medication, it reduces the adrenaline receptors portion in the nervous system, right? So that sympathetic nervous system, it reduces the adrenaline portion of that. So it relaxes the blood pressure, and it does so without causing a lot of issues for the fetus and for mom. So it's what's considered a first line blood pressure medication for pregnant women. So Cheryl, she is now on her medication. Her blood pressure is under control, and Cheryl was able to have a healthy baby boy. Boom, shout out to the boy moms. Yes, I have two myself. So shout out to all the boy moms. So Cheryl was able to keep her blood pressure under control during her pregnancy, right? She had blood pressure medications and she was on medications prior, but her medicine just had to be switched, right? She just had to notify her doc, and boom, she was able to have a safe pregnancy and have a safe delivery. So yay for Cheryl. Side effects of the methyl dopa: drowsiness and dizziness. Now let's talk about that. When you're pregnant, you're probably having both anyway, right? Especially in that third trimester. So we're just happy that it all worked out for Cheryl. Now, for these next couple of categories, we are going to talk about the medication itself, because these categories, the names of the categories are getting a little out of hand. I know you're not going to remember, right? So we're going to talk about this medication called Clonidine. Clonidine is a medication that a lot of you probably have heard of or know somebody who's on it, right? So this is in the category of a central agonist. So what does it do? It relaxes the blood vessels. So when the blood vessels nice and relaxed, the pressure can go down, right? So there are some side effects for this medication, such as dry mouth, constipation, drowsiness, right? One thing that's important about if you are on Clonidine, then you're not going to just stop your medication just like that. That's very dangerous for Clonidine, especially if you're on it on a consistent basis. So some people might know someone who might be on the Clonidine tablet, or someone might be on the Clonidine patch, right? They have a patch where they're on it so it's called a transdermal, right? That's what the patch means. Trans through dermal skin, the transdermal form of that. So if you're on these medication on a consistent basis and you just stop taking it, something called a rebound effect occurs. So what that means is that the blood pressure has been nice and controlled low, right? With your medication, you just stop taking it and the body is just not getting that medication anymore, and boom, blood pressure goes sky high, even higher than it was prior to you taking that medication. What this all means is, number one, you're not going to just stop it just like that. And number two, you let your doc know so that you can gradually be taken off that medication if you need to be, right? So if your body is in and knows that it needs a Clonidine consistently, you can't just stop taking it. That's very important for you to know with Clonidine. Now we have two other medications. They're in the same category. So you might have heard of this medicine. So hydrolyzing and minoxidil. So once you get to this level and you're on hydrolyzing or minoxidil, that means that your blood pressure is not controlled with other medications. So we're kind of at that point where you're on probably 3-4 different blood pressure medications at the same time, and your blood pressure is still very high. Now, some categories that can happen to our patients who have renal failure, right? End-stage renal disease. You're on dialysis. Your kidneys, as we've talked about in the first portion of blood pressure medication and control, is that the kidneys is a part of the center of the body that helps to keep the blood pressure under control. If your kidneys are malfunctioning or they're just not functioning at all, then your blood pressure can become uncontrolled. And despite medications, it might still be very hard to keep that under control. So once you're on hydrolyzine or minoxidil, that means that you're really at the point where there are many medications that are still not keeping your blood pressure under control, right? So how do these work? There are vasodilators. So vasodilators means that it relaxes the vessels, right? So you have normal blood vessel size. Vasoconstrictors squeezes the blood vessel. Vasodilators dilate, which means that it relaxes it, therefore bringing the blood pressure down. Now, minoxidil is a blood pressure medication that's used, like we said, for resistant blood pressure. There are some side effects for minoxidil. One of the side effects is fluid retention that we noted. And another side effect of minoxidil is hair growth. Now, I know right now you're thinking, wait a minute, minoxidil. I know I heard that before. Minoxidil, where have I heard that word before, right? Minoxidil, minoxidil, minoxidil. Boom. Oh, no, I know. Minoxidil. In the 1990s, minoxidil was all the crave for hair restoration. Rogaine. Yes, Rogaine. That's the same minoxidil. So I'm going to tell y'all a little story. So the pharmaceutical and the scientists who developed the minoxidil, they developed it, of course, for the heart, right? So they started to test the medication, and people were saying, I'm starting to get some hair growth here. And the scientists were like, yeah, maybe not. I don't know, really? And they're like, yeah, my hair is growing. So they, said, okay, well, if your hair is growing, let's just test it and we'll just have you just use the medication just for 2 weeks, not for any extended period of time. So the physicians, like I said, by the time you're on minoxidil, no other blood pressure medications, they're not really working. So these patients are really sick and they need to get this pressure down. So the physicians used it for that period of time, and some were using it for a little bit longer because they were getting such great effect on the blood pressure. Patients' hair started growing. Yes. So their hair started growing. So the minoxidil, the pharmaceutical company said, okay, well, maybe there is something about this, right? Tapered off and started making Rogaine. And that's the 1990s for us in a flash. Rogaine, that's the same minoxidil that's used for blood pressure, but of course not at the same dose, right? Now, we are about to end, but isn't there another medication that was built for something else, and then they started using it for another thing? Have you heard about that blue pill? Right? Exactly. So it's very interesting that although we have medications that are developed for one particular category and to treat something, the side effect might end up treating something else, and then you have a diversion. So minoxidil used for uncontrolled hypertension that is resistant to all the other categories of blood pressure medication, but we are having some great effect because they noticed the side effect is that they can grow the hair. And with that, they started making Rogaine, right? Just an interesting fact. So I hope you enjoyed today. Now let me know, did you like this info? If you do, hit that like button. What did you take away from this? Other than the fact that Rogaine makes your hair grow and it's the same minoxidil that's used for blood pressure? That's some great info. Let's leave a comment. Leave a comment. Now, do you know anyone who's on high blood pressure medication? If so, share this with them. It's very great info if I say so myself, but it's good for them to know what's going on in their body, right? And do not forget to subscribe to our YouTube channel. That is YouTube/Your Caring Docs. That's URCaringDocs. I'm Dr. Tamara Beckford with Your Caring Docs. I will see you guys next time. Thank you for coming. Bye-bye.